10 ways to recognize stroke. A stroke occurs when the blood flow to a part of the brain is disrupted or blocked. Being over the age of 40 is a risk factor for stroke, and there are two types of stroke: the ischemic and hemorrhagic. An ischemic stroke occurs when a blood vessel supplying the brain is obstructed or blocked, typically by a blood clot, thrombus, forming within the brain's blood vessels or traveling from another part of the body, embolism. This obstruction results in a reduced blood flow to a particular region of the brain, causing a shortage of oxygen and nutrients and leading to damage to the brain cells in that area. Ischemic strokes are the predominant type of stroke, constituting the majority of cases. A hemorrhagic stroke is characterized by bleeding within the brain, in contrast to ischemic strokes that arise from blood vessel blockages. Hemorrhagic strokes occur when a blood vessel ruptures, causing blood to escape into the nearby brain tissue. Two primary categories of hemorrhagic strokes are recognized. Please remember to hit the like button, subscribe and turn all notifications for our latest health and nutrition tips. Intracerebral hemorrhage, ICH, and subarachnoid hemorrhage, SAH. In United States of America, 87% of strokes are ischemic while 13% are hemorrhagic. Please note that all strokes have underlying causes. The human brain is a highly demanding organ, necessitating a substantial blood volume to function optimally. When the blood flow is interrupted, brain cells can begin to die within minutes of the disruption. This rapid deterioration is why a stroke is considered a medical emergency. Most of the risk factors that cause a stroke are treatable, such as high blood pressure, diabetes, high cholesterol, smoking and excessive drinking. Infections and the most common risk factors of stroke in young adults are high blood pressure, diabetes, high cholesterol, alcohol, drug use and exposure to OTC, health supplements, such as energy drinks. There is a minor percentage of stroke which causes are unknown to medical science. They are called cryptogenic stroke. They are related to genetic underlying conditions or unknown environmental. Always remember that stroke is preventable, treatable and beatable if adequate care is applied. Lack of awareness about stroke signs is common. A notable 35% of individuals under 40 are also unfamiliar with them. However, there is a simple and memorable solution. Use this acronym BEFAST. B stands for balance. Watch out for balance problems, like trouble with standing or walking. E is for eyes. Look for vision changes. This could be blurred vision or vision loss in one or both eyes. F is for face. Watch for droopiness on either side of the face or ask if the face feels numb. A stands for arm. Check for weakness or numbness in the arms or legs. Ask the person to raise their arms or legs to see if there are any issues. S is for speech. Listen for speech problems. This can include getting the words out or slurred speech. T is don't hesitate to seek all medical attention. Time plays a crucial factor for the treatment of stroke. One common error people often make is waiting for stroke symptoms to disappear on their own. If a stroke is not promptly treated, it can result in irreversible damage to the brain. 1. An early medical attention would create room for various tests like the computed tomography (CT) scan. Non-contrast CT scan. Often the first imaging test performed in acute settings to quickly assess the brain for bleeding or other abnormalities. 2. Magnetic resonance imaging (MRI). Diffusion-weighted imaging (DWI), sensitive to changes in water movement, helping to detect early signs of stroke. 3. Carotid ultrasound. This imaging technique uses sound waves to create pictures of the carotid arteries in the neck, assessing blood flow and identifying potential blockages. There is also a surgical operation called thrombectomy. This procedure is usually done by highly trained doctors at the Stoke Centre. After treatment, most people will require occupational physical or speech therapists to assist with the recovery process. Women can sometimes experience stroke in a slightly different way. Feeling of being unwell, milder symptoms and accompanied with headache. Women may experience strokes differently at times, with sensations of feeling unwell, milder symptoms, and the presence of a headache. After extensive research efforts, experts from both the American Heart Association and the American Stroke Association have formulated a simple approach called Life Simple 7. It comprises a set of measures that can assist in mitigating the risk of heart disease and stroke, which consist of the following: stop, manage blood pressure, eat better, manage cholesterol, eat well, get active, reduce blood sugar, and stop smoking. There is life and hope after a stroke. With time, new routines will become second nature. Rehabilitation can build strength, capability, and confidence. Recognize the warning signs and call 911 immediately. This can make the difference between a strong recovery and disability or even death.